What happens if I take opioids while on Suboxone? Opioids are among the most widely abused substances today, with much of the abuse stemming from prescription medications many individuals can access. Fortunately, treatments are available to help people suffering from opioid addiction, such as Suboxone. However, there are circumstances in which a person may be taking Suboxone and still abuse opioids. Doing so can lead to many dangerous consequences. This video discusses the potential dangers of taking opioids while on Suboxone. Suboxone is a medication used to help people recover from opioid addiction. It contains buprenorphine and naloxone, two components that work together to reduce cravings for opioids and block the effects of other opioids on the brain. Buprenorphine helps prevent withdrawal symptoms by attaching to the same receptors that opioids do. Naloxone, on the other hand, blocks the effects of opioids, preventing people from experiencing the high that comes with opioids. When someone is taking Suboxone as part of a treatment plan, it can be challenging to stop taking the medication when it is no longer needed. That is why it is essential to talk to your provider about any concerns about stopping the medication and how best to do so safely. Common Suboxone withdrawal symptoms include nausea, vomiting, muscle aches, sweating, chills, and difficulty sleeping. When taking Suboxone, you should not take other opioids as it can lead to dangerous drug interactions. You must avoid taking illicit substances such as heroin or fentanyl while on Suboxone, as the combination of these drugs can be deadly. Precipitated withdrawal is another risk associated with taking opioids while on Suboxone. That is when the effects of an opioid drug are enhanced and act too quickly, leading to severe withdrawal symptoms. If you or a loved one is struggling with opioid addiction, seeking help from a healthcare professional is crucial. Treatment options include medication-assisted treatment, or MAT, which combines medication, such as Suboxone, with counseling and behavioral therapies that can help address the underlying causes of addiction. In some situations, taking opioids while on Suboxone may be necessary, such as prescription opioids for acute pain. In these cases, it is best to talk to your doctor about the risks and how best to manage them. If you or a loved one is struggling with opioid addiction, please seek help from a qualified healthcare professional. Medication-assisted treatment, or MAT, which combines Suboxone counseling and behavioral therapies, can effectively treat opioid addiction. Still, discussing all potential risks and side effects with your provider is essential. SuboxoneDoctor.com offers professional resources such as treatment centers and doctors specializing in opioid addiction. Our team of experts is dedicated to helping you find the best treatment option that fits your needs to achieve long-term recovery. Dealing with opioid addiction may be challenging. However, you don't need to be alone. Visit SuboxoneDoctor.com to start your recovery journey.